Okay, I think we're recording. VST216 students, this is our trial run video that we are going to see how things go as we move ahead here. I want to go back and just start this one with a review of some of the terminology that we use. Up on the screen you can see the words para, just meaning to the side of, so a lot of you missed that incision line or forgot about those incision lines, so we'll review those as well. Para, to the side of. If you see the word peri, you're talking about around, so that means around. So for example, the pericardium, that's around the heart. Supra, if you see the word supra, above, think about above, so versus sub, of course, below. Costal would be something relating to the rib. So if you see the word costal, just think rib, and brachii is short. And so this was joined by Diamond. She's in the room now, so she wonders what's going on in here. Okay. These are our incision lines. So this was on the midterm. Again, A is ventral midline, so here's your ventral midline going up and down. B would be paramedian, so this is your median or midline to the side of. Okay, so this is to the side of the midline, so B would be a paramedian incision. C, this is your costal arch right here, so this is the arch of your ribs. So this would be a paracostal incision. This would be an incision maybe going into the liver, or looking at the gallbladder. So paracostal, and then D, parapreputial. So this is your prepuce. So this would be a prepuce, right? So we're just going to the side of the prepuce. So this would be an incision that we might make looking for a cryptorchid or something like that. A bladder surgery in a male dog, you'd have to do some type of parapreputial incision to gain access into the abdominal cavity. Just a review of MAC. Again, this is the concentration of gas that will produce no response to a painful stimulus in 50% of the patients. So each gas, isoflurane or sevoflurane, have different MACs, and so we look at 50% of patients. Things that work to lower MAC would be anesthetics, analgesics, hypotension, hypothermia, hypothyroid. So I like to just say the hypos. So again, we may not need as much, and we do not need as much anesthetic gas in those patients. So an animal whose blood pressure is low, an animal whose body temperature is cold, obviously an animal whose thyroid is underactive. So remember, thyroid is your metabolism hormone, so that would need to be corrected before we would do any type of anesthesia or surgery, and that's easily done with supplements, Synthroid. So it's always good to do thyroid testing on dogs prior to any type of surgical procedure. It's not necessarily young dogs, but middle-aged to older dogs, definitely it's an easy test to add on your panels. And again, when we're adding in other anesthetics, analgesics, opioids, they're going to have an effect on that MAC, and you may not need as much gas to keep those animals out under anesthesia. Some of the things that might increase the amount of MAC, obviously hyperthyroidism. We don't see that much. It's more common in the cat, not so common in the dog. So remember, dogs generally are hypothyroid, cats generally are hyperthyroid. If they're overheated or overactive, so a hyperactive dog, we certainly would want to give that dog some pre-med, sedation, something, take them down a notch before we induce general anesthesia. So it's always good to pre-med those dogs, a little Torb, a little something, Dexdorm, possibly a little ACE, to bring them down, give them 20-30 minutes to have the effects of that, and then give them their anesthesia. Much safer doing it that way. And then generally, again, the dial is set to 1.5 times MAC. So whatever the MAC is of that gas, isoflurane, say for the dog it's 1.3, we just generally set the dial to 2%. That would be 1.5 times MAC. So again, I just put up here, these are your max isoflurane. The canine is 1.3. For the cat, it's 1.6, and it's easy to remember. SIVO is just add a 1 on it. So for the canine, it's 2.3, and then for the cat, it's 2.6. So again, in the example I put up in the dog, using isoflurane in the dog, generally would start the dial at about 2%. It's just 1.5 times 1.3, get you to 195, or just up it to 2%. So that's a general starting point for most animals, and even the cat, even though if we do that math, it's a little bit higher than 2%. Most of the cats will start at 2%, and remember, we're going to use them on a non-rebreathing system. Don't forget about the F-Air can. That's your can that contains activated charcoal. It's going to absorb those gases as the gas moves through the pop-off or out of your non-rebreather before it enters room air. So these cans have a finite lifespan. You can weigh them. Once they gained up to 50 grams, you trash them, or you can actually keep track of the time that you use them surgically. So you usually have between 12 to 15 hours of use. They're relatively inexpensive, so when in doubt, you just swap them out and get new ones. And then they have a bracket that will directly mount them to the anesthetic cart. Again, you cannot leave that can set flat on the exam table or treatment table. It needs an area for gas to move out. So just make sure that you know that those are activated charcoals, and they absorb those anesthetic gases, and they have a finite lifespan. All right, 50 grams or 12 hours of use time. That's just an example. So those are your F-Air cans. Again, there's the holes in the bottom of the can, so you just can't put it flat on the table. It has to be open. Again, this connects to the pop-off part of your anesthetic system, or it's the direct line out of your non-rebreather, hooks right into that can. Okay, and that's just a bracket to hold it to the cart, to the right of it. Don't forget the anatomy of the, it's going to be hard for me to point, I have to get, my laser pointer's at school. This is our pop-off. Generally, the rebreathing bag is on the inhalation valve, the pop-off is on the exhalation valve. Don't forget about the circuit pressure gauge. Here's your barrel line. Make sure that you know where the soda sorb is and the barrel line. That's going to have a color change and prompt you to swap that out. This is your CO2 canister, so this is only active when we're using a rebreathing system. So this has no effect, and when we're using it for cats on a non-rebreather, this has to be changed out. Once it starts to get a colorimetric change, it has a finite lifespan as well. But again, in general, you can't really appreciate it. But over here is your rebreathing bag, and that's usually on your inhalation valve side, and your pop-off is on your exhalation valve side. And again, pop-off down to the F-Air. All right, so there's your pop-off. Again, don't forget a non-rebreather, the pros and cons of these systems. So you have some of my notes already. So the pros are we can make rapid changes in anesthetic gas. That's what makes them useful. Usually the cutoff is about 7 kilograms, 15, 16 pounds. Again, I'll use them on all cats, certainly small dogs, because I like controlling the anesthetic and I like controlling the oxygen level. So the chances of these animals becoming hypercapnic is not likely, and so I can make rapid changes. It's very easy. There is a little pop-off valve here, so if we needed to, for some reason, give a breath for the animal, I usually just pinch the exhalation hose here, or this output here, or you can push on the pop-off there to close this line and fill your bag with some anesthetic oxygen. Again, if an animal's not breathing, stops breathing, first thing I would do is shut off the vaporizer. So first thing in my mind, Dr. Phelps, animal's not breathing, shut off the vaporizer. All right, so let's end it there. going to upload this video. It's a short 10-minute video. We'll see how it goes, and this is hopefully how things will go in the future for us for 216, and I'll do my best to prepare the lectures and get them to you, and everything's going to work out just fine for all of you, so don't worry about that. And I just got to work on all this stuff, so